Hello, my name's Bob Leahy, and we're at the Canadian HIV AIDS Legal Network Symposium here in Toronto at the Novotel Hotel. And I'm talking to Micheal Vonn. Now, Micheal is with the BC Civil Liberties Association, right? Have I got that right? Yes. And Micheal, you've just come out of a talk talking about e-health records and stuff like that. Tell me what your theme was, if you could sum it up in just a few sentences. That's a challenge, I know.
The theme was that there's a great privacy jeopardy in the model that we're moving to in the e-health system, which is the electronic health record system, which is not simply about making information electronic and using information on a computer, but it's about centralizing the information and essentially allowing government to decide who has access to our healthcare information, not patients, not doctors making those decisions.
So we should be worried about that, I think is your premise.
Absolutely, we should be worried.
Now, you said something interesting, that a lot of this sort of weakening of patients' rights, and that's what we're talking about, is driven by economic factors. It's all about money. Can you tell me what your story on that one is?
Well, one of the considerations that we're told is important here is that e-health is supposed to save money. It's supposed to improve patient outcomes and save money. We're told this constantly. However, in fact, there's no evidence to suggest that. This is very much industry promoted, and the projections are excellent, except it actually never works out that way. These systems are incredibly expensive to maintain, and there's very little evidence that they promote good patient outcomes. But the money issue right now in Canada, we've spent over $5 billion so far on systems that we have very little to show.
Now, I'm a person living with HIV, as I told you, and people with HIV, I think, are particularly sensitive to having their health information shared. Tell me what kind of situations we might get into that. Suddenly, you're getting into BC as a leader. What kind of, as a person living with HIV, what should I be worried about?
Well, right now, the idea is that your centralized electronic healthcare record will be accessible throughout a system that will allow all healthcare providers at certain levels to be able to access it. So in terms of keeping your status confidential or controlling that control is effectively going to be removed both from you and from your physician. Canadian Medical Association has already announced that physicians should tell patients that once your information flows into that system, they cannot guarantee confidentiality. That has obvious ramifications.
Right. Now, you mentioned that BC was a sort of leader in e-health records, but we're seeing that other provinces are starting to catch up, and in fact, Ontario is in there too. Is that correct?
This is a Canadian model. So the group is called Canada Health Infoway. It is a federal hybrid group. It's not really government. It's kind of an NGO, but government funds it, that has a mandate to promote electronic healthcare records across the country.
Maybe anonymous testing, which is a key piece of a sexual health agenda, may not be quite so anonymous as it once was, certainly in BC. Perhaps you can talk about that.
Yeah, we've got an issue right now that so far across the country we're seeing very frequently that the first thing to be put into the repository is laboratory information. So even if you're doing point-of-care testing where you're getting a result that is staying within the point-of-care site, the confirmatory test is going into the laboratory. Right. So that's the part where you see you're starting to lose the ability to hang on to any sense of confidentiality around these records.
Micheal Vonn, you've been very generous with your time and talking to us. Thank you for talking to Positive Lite and the OHTN, and we appreciate your taking time to do that.
Lovely to be here.